Hey, my name is Wes and my pronouns are he, him. I'm a speech language pathologist and transgender speaker and consultant. I popped on to Eugene Speech Therapy's YouTube today to explore why an SLP might work with a trans or non binary person. This is part 3 in a 3-part series on queer and trans cultural responsiveness and gender affirming practices. As SLPs, we work with a wide variety of populations. Our scope of practice ranges from birth to death, from education settings to medical settings to private practice. We work with people on their speech, language, communication, cognition, voice, and swallowing. Sometimes we work with children experiencing developmental delays. Sometimes it's folks who are born with a disorder or syndrome. Other times it's someone who acquired a disorder or traumatic brain injury. We work with disabled folks and non-disabled folks. Sometimes it's not a disorder or disability at all, but an aspect of communication that they need help and support with in order to improve their quality of life. When we take a minute to notice the wide range of potential clients we may serve, it becomes clear that we may work with a trans or non binary person for any of the reasons that any person might need or want to work with an SLP. So, on that note, I want to make sure that we all have a clear understanding of what it means to be transgender or non binary. Transgender or trans refers to someone whose gender identity is different from the gender they were assigned at birth. And non binary refers to someone whose gender identity is not exclusively male or female, not exclusively man or woman or boy or girl, but rather maybe both, neither, or an expansion of. And it's also important to know what cisgender means. Cisgender or cis refers to someone whose gender identity is the same as the gender they were assigned at birth. Now, trans, non binary, cis, these are all identities that link back to the relationship that we have with our gender assigned at birth and our gender identity. People of all gender assignments and all gender identities may need or want speech therapy services at some point in their life. So, as SLPs, it's critical that we have an understanding of what this means, how different identities may intersect and show up, what types of discrimination the queer and trans community might be facing, challenges and even joys that may be present related to being LGBTQ+, and how to be culturally responsive and create environments in which people of all gender identities and all gender expressions can thrive and be celebrated. We can make space to foster a sense of inclusion and belonging within all of the work that we do. I also want to specifically mention that some SLPs provide gender affirming voice and communication services, which are explicitly for transgender and non binary people. So, if you are trans or non binary and wanting to work with someone on your voice or other aspects of your communication as it relates to your transition or to tapping into more experiences of gender affirmations, working with a speech language pathologist is one option. And if you are an SLP who is in this line of work or who wants to be in this line of work, there are some key considerations to keep in mind. Trans voice work is not only for trans women. Trans men and non binary folks can also benefit from voice therapy. However, just because trans and non binary folks can be candidates for therapy doesn't mean that all trans and non binary people are candidates for therapy. And what I mean by this is the only person that can determine if gender affirming voice therapy is appropriate is that person. It is a personal decision based on a multitude of factors, including satisfaction with their current voice, desire for change, accessibility, and so much more. Also, know that there is not one right or most desirable way to sound like or act like a man, a woman, or a non binary person. It is imperative that you enter into this work with your mission being to help the trans or non binary person reach their goals around gender affirming voice and communication. It is not our role to determine goals for them. They get to decide what type of voice and communication feels most authentic and affirming to them. And you're gonna need to do your own deep and continuous learning on the trans community and experience. You'll need to understand what hormone replacement therapy does and does not do, and how that relates to voice, breath, resonance, pitch, and so on. You'll also need to have an awareness and understanding of any equipment folks might be using or wearing that could impact things like their breath support. The most important thing is that you cannot expect your clients to teach you about the trans experience and trans culture. Most trans people have had negative experiences with medical providers and need to be reassured through your actions and words and culturally responsive practices that you are a person that we are safe to explore our authenticity with. We all can relate to how personal a voice is, how much we hold and carry in our voice. It is vulnerable and tender and beautiful work. And it is your responsibility to show up in ways that support your client's nervous system through your work together. Thank you so much for joining me in this 3-part series on queer and trans cultural responsiveness and gender affirming practices. I'm Wes. My pronouns are he, him, and you can find all of my contact info in the description of this video. See ya.